Hello everybody, welcome to class. Good evening to all of you and welcome to class. I'll just wait for few minutes so that I get some response from your side that whether I'm audible or visible to you or not. Okay, just let me know when I'm audible and visible to you. Good evening Vivek. So I'm audible to you and visible also, I hope. Thank you so much. That's thank you. Naveen, welcome. Manish, welcome. Right, okay. So Ravi also joined. Naveen, audible, visible, okay. Great. Okay. So now we are going to start this session, clinical neurophysiology part 4. As you know that although the name of this clinical neurophysiology, the questions are okay. You have my book, very good. So questions are basically related to physio only, right? Although the questions will be given with a clinical scenario, and in this clinical neurology part 4 we are going to discuss the spatial senses and decorticate and decerebrate rigidity. Regarding this, we are going to discuss this one. So spatial senses topic we will try to revise with this MCQ, right? And the decorticate decerebrate rigidity we are also going to listen here, right? So always you know that in my class, in my discussion, I always try to give some concept so that you can answer new MCQ in future. It's not that I will show you only MCQs and answer, because only MCQs and answer are nothing until and unless you are entering into the topic in depth, because nowadays the new questions will be there in examination. You are not going to get the old Visa Peter type of question, right? So you have to have a concept for proper answering in the examination. Hi Black Panther, welcome to class. Sivangi, welcome, right? So welcome all of you, welcome to class. Okay, now listen. So before going to the class, you know that because this is the neurophysiology part 4, I have already taken another 3 YouTube sessions. Okay, so in Unacademy YouTube channel, if you search on my name, you will find out those sessions. Okay, so here I have given some link, but it is difficult to follow this link, so it is better to give a search there in Unacademy YouTube link and you will find out there. Apart from that, I have a Telegram group. So the link of this Telegram group is here, but that group is not very often is used. Means if you post your question immediately, you are not going to get the answer, because I am not very active in that group, but I am very active in my Facebook group, so you can join there also. And in Unacademy Learner Platform app, you can follow me there by using this link. My user ID is trSou.manna1150 educator ID. So if you follow this educator ID, you can follow me there. So whenever I will take any kind of free sessions, you will be notified in your app, right? So it is better to follow there. Okay, now with this brief introduction, we are directly entering into the MCQ. So you will read the MCQs, there are enough time, it is not whole, and try to answer the MCQ. First MCQ is very simple, but we will discuss one whole topic with that MCQ. So the MCQ is here. Okay, so read the question. Commercially available Ajinomoto salt is used as a spices in Chinese dishes. It produces a special taste sensation known as umami, right? So this is a Neetpg MCQ, umami taste. Okay, now which of the following substances is responsible for this umami taste sensation? A very, very simple question, but we'll discuss some difficult thing with this simple question. That is the role, that is the main important here. So first of all, I want to know what is your answer here. Umami test. What is the chemical that gives this umami test, right? Okay. So acetic acid, potassium tetrate, okay, long chain organic substances containing nitrogen and glutamate. So I want your answer. Okay. Right. So Ravi has given answer, Naveen has given answer, Saptarshi also given answer. So you want to try? Anybody want to try? Vivek, you have also given answer D, right? Anybody else? Okay. So absolutely correct. All of you who has given answer, you are absolutely correct that it is nothing but the monosodium glutamate. Very, 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 very good. Okay. Sadia also very, very good. Okay. Solanki also very good. So it is nothing but monosodium glutamate. Excellent answer. Excellent answer. So you know that there are 5 primary tests. Among these 5 primary tests, this Umami is one of them. Okay. Now listen. This Umami is one of them is the primary test. Now this Umami is nothing but it is the taste of chemical that is nothing but monosodium glutamate. All of you are correct. It is nothing but monosodium glutamate, right? So this monosodium glutamate salt is available as an Ajinomoto salt brand name पे मिलता है. So this is Ajinomoto salt name पे मिलता है. Okay, and this is used in Chinese food as well as many other foods like Chinese restaurants in exactly you know that this Ajinomoto salt is commercially available not only in the Chinese food. You know the KFC, they also use this Chinese this Ajinomoto salt, and because of which you know that they have a very peculiar kind of taste sensation which you will never get in other kind of food, and that's why some people are very fond of this KFC. Like me also, and some people are very fond of this Chinese food. Okay, and that is because of this peculiar type of salt, and that is nothing but the Ajinomoto salt. And what is the chemical? Chemical is nothing but the monosodium glutamate, which is a basically excitatory neurotransmitter in your central nervous system, right? Now here I have to remember that this glutamate is giving this umami taste sensation. This is due to which receptor stimulation at the level of the taste bud or taste cell. So which receptor they are going to stimulate to give you this kind of umami taste? Write down the name of that receptor if you remember that what is the receptor which is stimulated by this glutamate salt. Because in CNS, central nervous system, if you look at, then you will find out that there are NMDA receptor for glutamate, AMPA receptor is also there for glutamate, kainate receptor is also there for glutamate, and there is metabotropic glutamate is also there for glutamate. Now tell me what type of receptor is present at the level of taste bud because of which this umami taste sensation is there. That is the question, right? So it can be a different question. That's why I'm asking you that although this question answer is very easy, now you tell me the receptor. Anybody? Saptarshi? It seems that you have great knowledge of this Chinese restaurant, right? Chinese restaurant syndrome, yes, because of this monosodium, right? Very good, very good. Excellent answer. Yes, so you are expert. So please remember, this is nothing but known as metabotropic glutamate receptor. This is nothing but metabotropic glutamate receptor. In short form, MGLUR type 4 is the main one. MGLUR type 4 is the main metabotropic glutamate receptor that is responsible for this umami taste sensation. Never forget this information for your NEET exam also, because they are going to ask you this kind of question. So according to Genom, that they are mainly going to stimulate your metabotropic glutamate receptor type 4, right? Now it is said that if you bite a ripe tomatoes inside your mouth, suppose there is a ripe tomatoes and you are biting that tomatoes inside your mouth, whenever you bite that tomato, some kind of peculiar taste sensation happens on your tongue, and that sensation is the typical sensation of umami sensation, right? Tomatoes, ripe tomatoes, okay? So if you just bite them, then you will get a juicy kind of taste, and that taste is nothing but the umami taste. Now forget about this umami, okay? Forget about tomatoes, okay? Now if I ask you that different taste sensation are there, primary 5 taste sensation are there, what are the different receptor? I now understood that it's a metabotropic glutamate receptor. Now sir, tell me the what about the other receptor? So now we are going to discuss a little bit this topic. So if you look at the taste bud structure architecture, okay, then you will find out that this is the single taste bud diagram I have put in front of you. So this is the single taste bud diagram. So inside this taste bud you are finding out that there are multiple cells. These cells are known as the taste cells. They are the actual cell which are containing this receptor, various receptor, maybe umami, maybe sweet, maybe sour, any kind of receptor. Now these taste cells are present inside this taste bud. At the top of this taste bud, you can find out that there is an opening, there is a pore through which the testant will enter inside this taste cell, and then it will stimulate the different types of cells. At least there are two broad group of taste cells there on your taste bud, and you can find out here that one type of cell is responsible for detection of the sweet, umami and bitter taste, and other type of cell is responsible for detection of salt and sour. So I have to remember this, that salt and sour, sweet, umami and bitter, they are detected by two different kind of cell because their receptor are different. Now this salt and sour, this is detected by some kind of ion channel receptor, because of which they are known as ionotropic receptor. But all of the sweet, umami and bitter, they are detected by G protein coupled receptor. G protein coupled receptor, and this G protein coupled receptor is also known as metabotropic receptor. This is also known as metabotropic receptor. Getting my point? So what I told that the sweet, umami and bitter, sweet, umami and bitter, they are detected by a different group of cell. The receptor is also different. What is the receptor? It is nothing but G protein coupled receptor. G protein coupled receptor is also known as metabotropic receptor. Okay, so they are metabotropic receptor. On the other hand, the salt and sour, they are detected by some ion channels which will be located here, ion channels, and through which some ions will enter inside the cell, and because of which the taste cell will be activated. Okay, and that's why this kind of receptor are known as the ionotropic receptor. Now if we look at that, what are the different this ionotropic receptor and what are the metabotropic receptor, okay, or glutamate metabotropic receptor or G protein coupled receptor, then look at this diagram. It is taken from Genome, right? So salt and sour, what are you finding out? That these two receptor, they are nothing but some ion channel. So this is the pore of the channel through which ions will enter inside the taste cell, and because of which the taste cell will be stimulated. So which ion is going to enter? In both of the cases, sodium is the main ion. In both of the cases, sodium is the main ion, right? So for the salt, we all know that salt is nothing but the NaCl. If you give the NaCl, then you are going to perceive the salt sensation. So salt is nothing but, it is nothing but sodium is going to enter. In case of sour, sour taste is nothing but it is the taste of proton H plus ion. If I give a small one drop of acetic acid, then you are going to perceive the sour taste. So it is nothing but acids, protons, which are going to give you the acid sour taste, or it is the taste of acid H plus ion. So how this H plus ion is leading to depolarization of the receptor or stimulation of the receptor? By entry of sodium. So basically this H plus ion is responsible for regulation of this ion channel, which is responsible for perception of sour, right? So this H plus ion, which is the sour taste producing substances, it is regulating this ion channel through which sodium is entering. So if the question is the salt and sour both are stimulating the receptor with the help of which ion entry, that is nothing but sodium in both the cases. In salt, Sodium is stimulating the receptor and sodium is directly entering through the receptor. In case of sour, the H plus is regulating this ion channel, okay, and through this ion channel sodium is entering. What is the name of this ion channel? Genong is writing in both of the cases the epithelial sodium channel or the Inac channel is responsible. But I'll show you in the next slide that apart from this Inac channel, for the sour taste there is a different kind of ion channel is there. Okay, I'll show you in the next slide. But before that, you look at the other half of this diagram, that is sweet, bitter, umami. I told you all three are which kind of receptor? Metabotropic receptor. Metabotropic receptor means they are coupled with the G protein receptor. That's why you are not getting any pore inside this receptor, because this is not ionotropic receptor, but all of these receptors are connected with a G protein. All of them are connected with a G protein through which the second messenger will be produces and then the receptor stimulation will be there, right? So what are the different subvariety of this G protein family that is giving rise to sweet, bitter and umami sensation? That is T1 and T2 receptor family of G protein. So T1R2, T1R3 and this is T2 family. So please remember that if I have to remember that which kind of G protein coupled receptor or which kind of GPCR is giving this kind of taste sensation, you have to remember two family of G protein, that is the T1 and T2 family of G protein coupled receptor. Getting my point? So look at the next slide, everything will be clear. Okay, so first of all these are the different taste receptor, ionotropic receptor and metabotropic receptor. We have already discussed that ionotropic receptor means it is nothing but ion channels. So salt sensitive taste and sour taste, read whatever is written here, very very important for your NEET exam as well as any kind of exam. This is the only slide that you have to remember. So salt sensitive taste is mediated by sodium selective channel, and this channel is nothing but the epithelial sodium channel or Inac channel. But sour taste is mediated by H plus ion, but this H plus ion is controlling the gate of a non-selective cation channel. This non-selective cation channel is known as TRP-P3 type of channel. TRP ion channel, you must have heard this name because TRP ion channel is very very famous for perception of the pain, for perception of temperature. TRP, you know that it stands for, it is nothing but transient receptor potential channel. Transient receptor potential channel. It has multiple subvariety. This TRP-P3 variety is responsible for this sour taste. Although Inac channel is also there for the sour taste, HCN, that is the hyperpolarization induced CAMP gated channel, which is the channel which is also present at the level of nodal tissue of the heart, HCN channel. Okay, hyperpolarization induced channel, hyperpolarization induced CAMP nucleotide gated channel, and acid sensing ion channel ASCI. This channel is also there for perception of the taste. Now if you are getting that I must have heard this kind of channel elsewhere in the body, obviously this epithelium sodium channel, they are present in almost all type of epithelium in our body. Like for example, one of the important place that you know is the collecting duct of kidney, okay, collecting duct of nephron. Along with that, it is also present in the respiratory epithelium, GIT epithelium also. So they are responsible for reabsorption of the sodium there. HCN channel, I told you, they are present in the nodal tissue, SA nodal tissue, and responsible for pre-potential generation there. And this acid sensing ion channel, it is also present on neurons, right? And they are responsible for perception of pain, chemical pain. If there is H plus ion which is causing pain, then this is the channel which is responsible for there. But we are not discussing the pain sensation right now. We are discussing the taste sensation. Which type of taste? Sauer test. So please remember, this Sauer test is very very important because different variety of ion channels are there which are responsible for perception of this Sauer test. And what are the different ion channel? We have discussed TRPP3, INAC channel, ACN channel, and AACI channel. Now read the other half of this thing. Metabotropic receptor. I told you metabotropic receptor means they are the G protein coupled receptor. G protein coupled receptor, so GPCR. What family of G protein coupled receptor? There are A, B, C different types of family, right? Here we are going to discuss that T1 and T2 receptor, T1 and T2 receptor family, they are main for the perception of these three kind of taste sensation, that is nothing but umami, bitter and sweet. Now this umami taste sensation, all of you have answered, okay, all of you, or I think Saini has given answer and Saptorsi has also given answer, that this is nothing but MGLU4. This MGLU4, that is the metabotropic glutamate receptor type 4, they are under the category of T1R1 receptor and T1R3 receptor. If you don't remember all of this detail, at least remember that it is nothing but the metabotropic glutamate receptor type 4 which is responsible for umami taste sensation. Okay, but it will be better if you also remember that this is nothing but T1R and T1R1 and T1R3 receptor family. On the other hand, bitter taste is mediated by T2 family, T2 receptor family, and sweet taste is mediated by T1 and T2, R2 and R3 receptor, R2 and R3 receptor. So this is nothing but T1 family, but T1 family ka R2 and R3 variety, right? So these are the things that you have to remember about metabotropic receptor which are responsible for this chemical senses or taste, right? This is all about the taste sensation in brief. At least you remember this, your NEET PG answer will be done. Okay, now look at here. So here the question is, bitter taste is mediated by the action of, right? By the action of. So it is very easy question now. It is very easy question. So bitter, umami and sweet taste, they are mediated by which kind of receptor? Now you answer. All of you type your answer because you have listened and I want you answer. Yes, Saini, you have given answer. Anybody else you want to answer? All of you agree? All of you? B, right? Ravi has also given answer, very good. Vivek also given answer. Avirup, very good, Avirup. Okay, so this is nothing but our G protein coupled receptor or metabotropic receptor, right? So this is the second question answer, bitter taste, right? This is a NEET PG entrance question. Now coming to the next question. Now here, again a simple question, but given in a complex fashion. Very good, Sumanto, right? Now you attempt the next question. One medical student is performing examination of the first cranial nerve. Okay, that is the olfactory nerve, first cranial nerve, right? Okay, so while performing examination, the student should keep in mind that the olfactory receptor cells belong to which of the following group of cell, right? So this is again a very very easy question, very very easy question. I want you everybody answer this question. Okay, Sumanta has given a quick answer. Okay, I'll wait for other student to answer also. First cranial nerve examination you are performing as a medical student in first year MBBS, and you are performing the olfaction, right? So anybody? Manish, Ravi, good try, good. Manish, why you deleted your answer? Yash, yes. Answer A you have given. Okay. So now you are saying D. D is C, modified epithelium cell. Okay. So olfactory receptor cell, where they are located? They are located at the roof of the nose, and they are nothing but no. It's not C, it's not D. Pseudo-unipolar neuron, they are the true for every sensory pathway, like for example touch, pressure, pain. All of these are kind of pseudo-unipolar neuron, but it's under the spatial sense now. So here the receptor cell are also spatial, right? So here the receptor cell are located on bipolar neuron. So this Sumanto has given a very good answer. Okay, Mani's previous answer was correct. Okay, so this is very painful whenever you change your answer and that answer is wrong. That is very painful. Okay, in examination if you do like this now, then it's a severe lamentation will happen after that. Manish has given answer D. No, yes, Patel has given correct answer, that is the bipolar neuron. Okay, so okay, so I'll go to this diagram before that. So before that, just think. So at the roof of both of your nose, there is an olfactory epithelium, right? So there is an olfactory epithelium. This epithelium size is equal to 10 centimeter square, right? So around 10. Now the size is approximately 10 centimeter square. Now this olfactory epithelium contain receptor cells, and these receptor cells are nothing but bipolar neurons, right? They are bipolar neuron. So this bipolar neuron, how they are arranged? So if I look at a single bipolar cell, so this is the typical diagram of the bipolar neuron, right? Okay, so this is the typical diagram of a bipolar neuron. This is the cell body, right? And this is the axon part of this, right? And this is the dendrites. So this dendrite contains cilia. Okay, around 6 to 12 cilia there from a single bipolar neuron, and these dendrites are projected into this olfactory epithelium. These dendrites are projected into this olfactory epithelium. Getting my point, right? So what is happening at the level of this dendrites? So on the tip of these dendrites, what is there? There are various olfactory receptors are present. Olfactory receptors are present, right? So this is the location of the olfactory receptor. So what I told that olfactory receptor, they are located on a bipolar cell. So basically this bipolar sensory neuron, they are nothing but your olfactory neuron. Okay, where they are located? They are located on the roof of the nose, that is the olfactory epithelium, right? And it is said that olfactory epithelium is the area where the neurons are very close to the external environment. Everywhere in your body the neurons are very much protected, but here is the area where the neurons are very close to the or exposed to the external environment, right? So this bipolar neuron, they contain dendrites, and at the tip of this dendrite there are cilia. This cilia contain actually the olfactory receptor. What kind of receptor they are? Again, they are G protein coupled receptor. So please, you have to remember this, that olfaction. So whenever some chemical molecule, whenever some odorant molecule will reach here, they are going to stimulate this receptor. Then this bipolar cell will produce, first it will produce the receptor potential. So what I am saying, it will first produce the receptor potential, then this receptor potential will be converted into an action potential, and then this action potential will travel down through these axons, and this action potential will reach at the level of olfactory bulb. It will reach at the level of olfactory bulb, right? Olfactory bulb. So all of you know that this olfactory sensory neuron, which are the bipolar cell, they will pierces through the cribriform plate of the ethmoid bone. So it is piercing through that ethmoid bone cribriform plate, and then it is reaching at the level of the olfactory bulb. So olfactory bulb is nothing but It's a big structure where all of the axons are going to merge with the second order neuron of the olfactory pathway. Listen carefully whatever I am saying. So this olfactory receptor, they are located on the bipolar neuron. They are the olfactory sensory neuron. So this is my first order neuron. This is my first order neuron. Then this first order neuron is reaching at the level of olfactory bulb. From the level of olfactory bulb, the second order neuron of this pathway will start. The second order neuron of this pathway will start, and this second order neuron will directly enter into the level of the cerebral cortex, bypassing the thalamus. So please remember, this is the different thing which you have to remember here, because in every sensory pathway, whether it is touch or whether it is pain, they take help of three neuron, okay, and they first relay at the level of thalamus, and then from thalamus it reach up to the level of cortex, like thalamus will be here. But in case of olfactory pathway, this is the exception. This is the only sensory pathway which is directly going at the level of cortex without going through the thalamus or bypassing the thalamus. From the cortex, it may reach to the thalamus later on. But you have to remember that from the second order neuron, they are not relaying at the level of thalamus, they are bypassing the thalamus and directly reaching at the level of cerebral cortex. Name of this second order neuron, you have to remember, they are known as the mitral cell and tufted cell. Two types of second order neuron are there. One is the mitral cell or mitral cell, whatever you say, and second one is the tufted cell. They are the name of this second order neuron of this olfactory pathway, right? And with the help of this second order neuron, they are reaching at the level of cortex. So what is the bottom line? Bottom line is that olfactory pathway require only two sensory neuron to reach at the level of cerebral cortex. First neuron is the bipolar cell, which is located at the level of olfactory sensory epithelium, and second order neuron is starting at the level of olfactory bulb. Here the mitral and tufted cell are the second order neuron, and they are directly reaching up to the level of cerebral cortex. Okay, so this is the same diagram I am showing you here. Okay, so look at here. So this is bipolar neuron for olfaction. So this is the bipolar neuron, you can easily see here, and it is exposed to the nasal cavity, and these are nothing but the olfactory receptor. So this is my first order neuron. Then this first order neuron is reaching at the level of olfactory bulb. From the level of the olfactory bulb, the second order neuron will start, and second order neuron will reach at the level of cerebral cortex. So this is the thing that you have to remember here. Got it, everybody? Okay, so this is about olfactory sensory neuron. Okay. Now third question in front of you. Vision is sequential change inside photoreceptor cell. When light strike the eye, which of the following increases? Which of the following increases? Try to answer. Okay, then we will discuss. So I am waiting for the answer from your side, then I will discuss. Anybody ready with the answer? Which of the following increases? So number A is the activity of the transduction. Number B is the amount of transmitter released from photoreceptor cell. Number C, concentration of calcium within the photoreceptor cell. And number 4, activity of the guanylyl cyclase. Okay, so 3 answer I got. Vivek has given answer, Patel has given answer, and okay, right, and Vivek has also given second answer. Anybody else want to try answer? Okay, so look at here, you are correct, absolutely correct, that here is your answer is increase in the activity of transduction. So now if I ask you what is this transduction, what is the transduction in case of vision or olfactory pathway? Transduction is nothing but it is the G protein, it is the name of the G protein which is responsible for the vision. Right. So if I draw a schematic diagram of this rod cell, so quick discussion of this. phototransduction. This is also an important topic. So suppose this is the rod cell. So all of you know that the outer segment of the rod cell contain optic disc like this. Now this optic disc, okay, yes, okay, so this optic disc, they are basically located on the outer half of this rod cell. So this is my optic disc, fine. So this optic disc, it contains the rhodopsin molecule. All of you know that it is nothing but 11 cis retinal and opsin molecule will be there. So this is the retinal and this blue color structure is the opsin. Close to this rhodopsin molecule, so this is nothing but my rhodopsin molecule. Close to this rhodopsin molecule, there is the G protein of rod and cone cell is there, and the name of this G protein is nothing but your transducin, nothing but your transduction. Now, when there is no light inside this dark cell, so suppose when there is no light inside this rod cell, so suppose in case of dark condition, no light, what will happen? Inside this rod cell, there is huge amount of CGMP. There will be huge amount of CGMP, cyclic guanosine monophosphate. Now question is, where from this CGMP is coming? This is coming from by the enzyme, that is the guanylyl cyclase. So the option number D, what is given here, that guanylyl cyclase is active. So suppose this is GC, guanylyl cyclase enzyme. This enzyme will convert the GTP molecule into this CGMP molecule. So it will convert the GTP molecule into this CGMP molecule. That's why the CGMP level will be very, very high. Because of this increased amount of CGMP, what will happen? There is a non-specific cation channel present here. So it's a non-specific cation channel, and this cation channel is gated by, it is gated by CGMP only. That means if the CGMP level is very, very high, then the channel is remain in an open condition, right? Then the channel will remain in an open condition. So when there is no light in the retina, what is going to happen? The CGMP level is high because of this guanylyl cyclase enzyme activity, right? So this CGMP, it is going to act on this receptor, and it will stimulate this receptor for its opening, and through this receptor there will be entry of ion. Most of the cases it is sodium, although little amount of calcium will also enter through this receptor. Little amount of calcium will also enter through this receptor. So please remember that sodium is also entering, calcium is also entering. Because of this sodium and calcium entry, what is happening? There is flow of some current inside this rod cell. There is flow of some current inside this rod cell. So sodium is entering into the outer segment. At the inner segment, there is presence of sodium potassium ATPase pump, which is going to throw sodium out of the cell again, and it is taking back potassium inside the cell. Potassium will go out through a different kind of channel. So the sodium which has entered from this outer segment, now this sodium will reach into this inner segment, and then this sodium is further going to enter from this outer segment. So this is inner segment, this is outer segment. So basically in presence of dark, I can find out that there is flow of some current from this inner segment to outer segment, and again from this outer segment to this inner segment. This kind of current which is flowing in presence of dark, the name of this current is nothing but dark current. Dark current. And because of this dark current flowing during the dark condition, there will be depolarization of this receptor cell. There will be depolarization of this receptor cell. When this receptor cell is depolarized, what will happen? The receptor cell is going to produce huge amount of neurotransmitter, and this neurotransmitter is nothing but glutamate. So please remember, many information I have given here. So you have to remember, in presence of dark, what is happening? The retinal rod cell and cone cells, they are producing huge amount of glutamate. Why? Because the cells are depolarized. Why the cells are depolarized? Because of a current flow inside the cell, and that current is nothing but known as dark current. If I ask you, dark current is mainly due to which ion? It is mainly due to sodium ion, although calcium ion is also there for the dark current, right? So this is happening in dark condition. When light fall on this rod and cone cell, the mechanism will change into a different variety. So before going into the light mechanism, look at this diagram, exact diagram from the Candle textbook of neurophysiology. So you can see here this diagram, that this is the inner segment of the rod cell, sodium is going out, okay, and this sodium is again entering through this outer segment. So this sodium which is going here, then it is going to enter from the outer segment here. So there is a flow of some current, and this current is mainly due to sodium current, although calcium is also there. This is known as the dark current. Dark current is due to which type of channel? This is cGMP gated channel. This is occurring in condition of dark. Now, when the light is not there, then the rhodopsin molecule is present here, and rhodopsin molecule means we all know that it is nothing but 11-cis retinal plus opsin molecule is there. So this is the long protein opsin, and 11-cis retinal is present inside this. So this is nothing but retinal, and this is the opsin. Beside this rhodopsin molecule, you can find out that this is the T transport. This is nothing but transducin. This is nothing but transducin or G protein. G protein means it is composed of alpha subunit and beta gamma subunit. So you can find out all of them. And just beside this G protein, also note down this PDE. This is nothing but phosphodiesterase enzyme. This is nothing but phosphodiesterase, okay, enzyme. This is nothing but phosphodiesterase enzyme. So when there is dark, I already told you that this GTP molecule will be converted into cGMP, and because of this cGMP, this channel is open through which the sodium is also entering, calcium is also entering. Now when the light is falling on this outer segment of this rod and cone cell, so now the light is coming. We all know that this opsin, okay, is going to change its conformation. Whenever opsin is going to change its conformation, what will happen? Now the opsin is going to interact with this G protein. Then this G protein will be activated. G protein activation means this alpha subunit will be separated. Now this alpha subunit is going to stimulate this phosphodiesterase enzyme, and this phosphodiesterase enzyme is going to break down this cGMP molecule. What I told? Many things I told. So if I discuss here quickly that what is happening in presence of light, okay, transduces increases activity of PDE. It activates the PDE, right? Okay, so this is the optic disc. So whenever light is falling here, look at the mechanism once again. So whenever the light is coming here, okay, so what I told, that the rhodopsin molecule which is there, the opsin will change its conformation. So this is opsin which is changing its conformation. Then this opsin is stimulating this G protein which is connected here. Whenever this G protein is stimulated, the alpha subunit is the regulatory subunit, it will be separated out, and this alpha subunit, it is going to activate one enzyme, and that is nothing but PDE, phosphodiesterase enzyme. Whenever this phosphodiesterase enzyme is active, what it is going to do? It is going to break down your cGMP molecule into 5' guanosine monophosphate. Now whenever you have converted this cGMP into 5' guanosine monophosphate, then I can understand that inside this rod cell the amount of cGMP is decreased. Because of the decreased cGMP, what will happen? The channel which was present on the outer segment of this rod and cone cell, that is the non-specific cation channel, what will happen to this channel? That channel will be closed. And because of the closed of this channel, okay, non-specific cation channel which was there, what will happen? The dark current is not going to flow. So the dark current will be stopped. And because of the current flow stop, what will happen? There will be hyperpolarization of the photoreceptor cell. Now whenever there is hyperpolarization, exactly whenever there is hyperpolarization, what will happen? The photoreceptor cell, the glutamate released from the photoreceptor cell will be decreased in amount. Glutamate released will be decreased in amount. Now when the glutamate release decreases by some mechanism, it is going to activate your bipolar cell. Okay, the mechanism is still not confirmatory, but there are different variety of bipolar cell. But when the glutamate release is decreased, it is going to activate your bipolar cell, and bipolar cell activation is ultimately going to produce action potential at the level of ganglionic cell. Please remember this information, that it is the ganglionic cell which is the only cell in the retina which can produce action potential. All other cell, either they will produce hyperpolarization or they will produce depolarization. They are not going to produce the action potential at all. Either they will be produce hyperpolarization or they will be produce depolarization, but they are not going to produce the action potential. It is only the ganglionic cell which is going to produce the action potential, and we all know that the axons of this ganglionic cell is nothing but my optic nerve. So the action potential will travel down this optic nerve. This is the complete mechanism by which phototransduction is occurring. So in presence of light, photoreceptor cell is hyperpolarized, glutamate release decrease, which activate the bipolar cell that produces action potential on ganglionic cell. Now if you look at the original question, original question here. So look, the question is asking which of the following is increased in presence of light. So when the light is striking the retina, which of the following increases? So amount of neurotransmitter released from the photoreceptor cell, we all know, just we have seen that light strike means this will be decrease in the rod cell. The concentration of calcium within the photoreceptor cell, because the channel is closed, calcium concentration, sodium concentration, both will be decreasing inside the cell, and because of this decrement there will be hyperpolarization. The activity of the guanylate cyclase, no, this will be also decreased because guanylate cyclase activity is high in presence of dark, in presence of light, not in presence of dark. So that's why these three are not the answer. The A is the answer in this question. All of you tell me whether you got this thing. This is very important topic. All of you tell me whether you understood this or not. This basic mechanism of phototransduction. Whether you understood or not. Give me a thumbs up. Okay? Okay. Right? Now after discussion of this question is very easy for you. Okay? So now everybody answer this question, that the rod receptor potential differ from other sensory receptor potential. Very easy question. All our sensory receptor in our body, whenever they are stimulated by stimulus, pain receptor, touch receptor, you stimulate, what will happen? All receptor will be depolarized, and then this depolarization will produce action potential. It is different in case of photoreceptor only. Just now we have discussed. No. Here the question is the rod receptor cell. This rod receptor cell, just now we have seen that rod receptor potential differ from other sensory receptor potential in that it shows hyperpolarization in presence of stimuli. Right? It shows hyperpolarization in presence of stimuli. Okay. This is the question where they are asking the rod receptor potential. Receptor potential means when it is stimulated by stimulus. Receptor potential means when it is stimulated by stimulus. Okay. You have seen that in dark it is producing depolarization, but that is not receptor potential. Receptor potential means the stimulus is there. So what is the stimulus for rod and cone? Stimulus for rod and cone is nothing but light. Suppose I am asking about the touch receptor. What is the stimulus for them? Touch. So if you give a touch, if you give a pain, then the touch receptor, pain receptor, they are going to be depolarized. Right? And then depolarization will produce action potential. That is the meaning of receptor potential. Receptor is generating a potential in presence of stimulus. For rod and cones, receptor potential will only be produced in presence of stimulus. What is the stimulus? Light is the stimulus. So they are basically asking you a question here indirectly, that in presence of light, what will happen to the receptor cell? Getting my point? NEET PG question. looking like very simple question, that it can be depolarization is also occurring in the rod cell, but that is not receptor potential, that is a dark current which is in absence of stimulus, but in presence of stimulus it will be hyperpolarized, and that is the meaning of receptor potential in presence of stimulus. That's why the answer here is the hyperpolarization. Got it, everybody? Okay, everybody, this is clear? Tell me. Okay, now next question. Now this question is about sound transduction, right? Very good, thank you Vivek for responding. Thank you Patel. Okay, Avriv, you are also understanding, I hope. Easy question for you. Good. So Vaishnavi, what is the answer in this question? So a PhD student recording the electrical current from the inner hair cell to understand the mechanism of sound transduction. Oh my god. Right, very good. So he will observe that the depolarization of the hair cell in the cochlea is primarily due to flow of. Okay. So there are two correct answer, but you have to choose the single best answer. Yes. So choose both the answer. Choose both the answer. Choose both the answer. Okay. Absolutely, absolutely. All of you are correct. Sumanto, you have given correct answer. Patel, you have given correct answer. Very good, very good. Potassium is the answer. Potassium is the answer. But you have to choose another answer. Then calcium is also the answer. But single best answer is potassium into the cell. That is the D. Right? That is the D. Now look at. All of you know that the depolarization of the hair cell is present inside the organ of Corti, and surrounding the hair cell, what is there? There is nothing but endolymph. All of you know this. Okay, endolymph. And the endolymph contains huge amount of highest concentration of, high concentration of potassium. Rather than highest, I should write down very, very high concentration of potassium, right? Like that of the intracellular fluid, high concentration of potassium is there. So I can imagine that surrounding the rod cell, surrounding the hair cell, there are huge amount of potassium present, although low amount of calcium is also present in the endolymph. Because of this huge amount of potassium continuously secretion by the stria vascularis, you know that the endolymph has a potential, and that is known as the endolymphatic potential. NEET exam question. Endolymphatic potential, what is the value of endolymphatic potential? Answer. Endolymphatic potential, because of this huge amount of potassium secretion, the endolymph contain a potential, that's a kind of positive voltage always present inside the endolymph. And what is that potential? Endolymphatic potential is how much? Answer. No, that is not endolymphatic potential. Endolymphatic potential is how much? I am asking you to write down one number. Endolymphatic potential is how much? Plus how much? Plus 85 millivolt to plus 90 millivolt. This is the answer of the NEET exam question that has been asked. Yes, plus 85 to plus 90 millivolt. This is the potential which is present at the level of endolymph. That's why it is known as the endolymphatic potential. This is known as the endolymphatic potential. Getting my point? Okay. This is nothing but your endolymphatic potential. Now, the hair cell structure, if you look at, okay, so you have answer na plus 60. Patel, so this is your answer. You are answering this, that RMP of the hair cell you are answering. Okay, so if you look at the hair cell, then all of you know that at the tip of this there are multiple stereocilia and there is a single kinocilia. You all know that this kinocilium or kinocilium, it is not present in case of adult hair cell. Kinocilium is degenerated, but only there will be stereocilia at the tip of this hair cell. And how many? 30 to 150 cilia will be present on a single hair cell. And if you measure the RMP of this hair cell, then this is nothing but minus 60 millivolt. This is nothing but minus 60 millivolt. millivolt. Now here I will tell you one thing, one important concept, that you all know that the hair cell, they are located, suppose this is your hair cell, so this is the hair, tip of the hair. Everybody listen carefully, important. Okay, the hair cell is located like this. This is your basilar membrane. So this is your basilar membrane, all of you know, and this is your Reissner's membrane, right? And all of you know that the basilar membrane and Reissner membrane ke bahar, the fluid which is present, that is nothing but your perilimb, and this is also your perilimb, and this is nothing but your endolimb. Just now we have discussed that endolimb contain a potential of plus 85 millivolt. Got it? Okay. Now, if I measure the RMP of this hair cell by putting one electrode here and one electrode in the perilimb. So one electrode is here and one electrode in the perilimb, and I am connecting one galvanometer in between. Then I will get the recording of minus 60 millivolt in this galvanometer. Again I am repeating, important. So if I measure the RMP, okay, with respect to perilimb, so as if the perilimb membrane voltage is 0 millivolt, okay, perilimb membrane voltage is 0 millivolt. So if I measure the RMP of this hair cell in comparison to perilimb, that is minus 60, that is inside voltage is minus 60 in comparison to outside voltage. What is the outside voltage? Outside voltage is 0, that is the perilimb voltage. Okay, so RMP is nothing but, all of you know that RMP is nothing but in minus out voltage difference, that is nothing but your RMP. Now rather than putting this electrode inside this perilimb, now if I shift the electrode, I am taking a different color. Now I am shifting this electrode, one electrode inside the hair cell again, but another electrode inside the endolimb, and in between I am connecting on galvanometer here. How much will be my recording of RMP in this condition? How much will be the recording of RMP in this condition? Getting my point? Now I have shifted this outside electrode from perilimb to the endolimb. So one electrode is inside the hair cell and one electrode is inside the endolimb. So what I told, RMP is what? RMP is inside voltage in comparison to outside voltage. So inside voltage, if I calculate the new RMP, inside voltage is minus 60 millivolt, minus outside voltage now is plus 85 millivolt. So now this is my new RMP. So RMP will be in minus out voltage, in minus out voltage different. Outside originally if you put it into perilimb, outside was 0, that's why it was net minus 60 millivolt. Now the outside voltage is plus 85, it's not minus. Because of this, now the RMP with respect to endolimb is nothing but 145 millivolt to 150 millivolt if you consider this as plus 90 millivolt. That's why in some of the book you will find out that RMP of the hair cell is nothing but minus 150 millivolt and RMP of the hair cell is minus 60 millivolt, which is given in GNOM. So they depend. If the RMP with respect to perilimb, then your answer is minus 60 millivolt. If the RMP with respect to endolimb, then your answer is minus 150 millivolt. Both are same thing. But because we know that endolymphatic potential is plus 85 millivolt, if you measure the potential with respect to endolimb, then the RMP will be minus 150. But if you measure the potential with respect to perilimb, that is minus 60 millivolt. Generally, if this is not mentioned that with respect to what, then your answer will be it is with respect to perilimb only. That is minus 60 millivolt is your answer. You tell me whether you got this thing or not. Okay. So this is important for your understanding, right? This is important for your understanding. I am telling you repeatedly. Please try to understand that, and I hope you have understood. Give me a thumbs up whether you got this thing or not. Okay. So Puneet, you got it. Dr. Patel, Puneet, Vaishnavi. Okay. Sumant, are you there? All of you, Aviru, you there or not? Okay. So tell me whether you understood this or not. Okay. Give me a nod, please. Okay. Yes. Very good. Very good. Okay, so that is important. Now you look at, suppose this is the cilia. Okay, stereocilia. Very good Anupa. Very good Sumanta. Now look at what I am discussing now. Now I am discussing the hair which are present at the tip of this hair cell. So suppose these are the cilia, hair. These are the cilia. Okay, stereocilia which are present at the top of this hair cell. Okay, if you look at this hair, then you will find out that there is a spring-like molecule which is connected from the tip of the smaller size hair to the side of the taller size hair. What I told, from tip to side there is a link. This is known as the tip link or tip to side link. This link is formed by a spring-like molecule, and the protein which is forming this link is nothing but actin protein. So what I told, from the tip of this smaller size hair to the side of the longer size hair, there is a linking. This is tip link. Now if all of the hair are moving in this direction, okay, towards the longest stereocilia, then what is going to happen? This spring will be stretched. But if all of the hair are moving in this direction, then the spring will be relaxed. I can understand like this. So when all of the hair are moving in this longest hair direction, what will happen? There is a mechanosensitive channel connected with this spring. There is a mechanosensitive channel which is connected with this spring-like molecule. This is a mechanosensitive channel. Whenever the spring is stretched, this will lead to opening of this non-specific cation channel which is present at the present hair. Okay, so that's why the hair cell are known as the mechanosensitive channel, mechanosensitive receptor. That's why the hair cells are known as mechanosensitive receptor, because it is detecting the mechanical stimulus. Okay, whenever the hair bending is there, whenever the hair movement is there towards the longest cilia, what is happening? This channel is opening up, and whenever the channel will open up, because this hairs are surrounded by huge amount of potassium, the potassium is going to enter inside this cell. The potassium is going to enter inside this cell. Along with potassium, small amount of calcium can also enter, because it's a non-specific cation channel. Now because of the entry of this potassium and calcium, what will happen? There will be depolarization of this hair cell. And this depolarization is nothing but receptor potential. If this receptor potential is crossing, if this receptor potential is going above minus 50 millivolt, minus 50, what was the RMP? RMP was minus 60 millivolt. Now this receptor potential is going towards the depolarization. Okay, whenever it is going above minus 50 millivolt, this is the threshold voltage of this hair cell. This, whenever it is going above minus 50 millivolt, this hair cell is going to produce neurotransmitter. Okay, there will be increased neurotransmitter production, and this neurotransmitter is going to produce action potential at the level of neuron, at the level of auditory division of cranial nerve. It is going to produce action potential there, and then this action potential reach at the level of brain, and that is nothing but your sound perception. Getting my point? But if all of the hair are moving in the opposite direction like this, rather than this depolarization, there will be hyperpolarization of this receptor cell. That's why if there is hyperpolarization, sound transduction is not going to happen. But whenever all of this hair are moving towards the longest cilia, then it will produce depolarization, and this depolarization is going to open up the cation channel. That cation channel is producing depolarization, and that is producing receptor potential. If this receptor potential above the threshold voltage, then it is going to release the neurotransmitter glutamate from this hair cell, and then the hair cell is going to produce action potential at the level of neuron. This is the mechanism by which sound transduction occur. Got it everybody? Got it everybody? Okay. Now tell me whether you understood this or not. Okay. Tell me whether you understood this or not. Okay. Now here I am finishing my session because I am going above the time, so it's not permitted. So I will come with again another YouTube session when we will discuss some more topic. Okay, clinical physiology like this. Okay, so I hope you are going to join that session also. So I am finishing the session. Thank you so much for listening me. Okay, and bear with me for 1 hour. And this is just for your promotion purpose, that I am taking this capsule course on central nervous system physiology. Okay, so here I am teaching almost all of the topic in central nervous system, which is there in Genome. Around 19-hour classes I am taking in this topic, but this is a paid classes. So if you want to join these classes, please follow this link and use my code, that is DRSOUMEN10, right? It will give you 10% discount for the joining. Now this is for promotion purpose, that the batch course is going on in the NEET exam and NEET courses, and this batch course has started already, and there is another batch course is going to start soon. If you want to join this batch course, again you can join. I am going to take the physiology there in rapid revision pattern, 24 hours, the whole physiology will be revised there, followed by there will be MCQ marathon. I am also going to take that, right? So these are the other teachers in this batch course, not only me, there are big name also there, so you can follow that what are the teacher for your anatomy, what are the teacher for your biochemistry, everything is given here. Detail of the course you can also available from the Unacademy page also, you can follow there. And if you planning to subscribe, then use my code, this is DRSoumen S10, that is for 10% discount, and this is for few upcoming classes. Okay, so you can attend those session, but for attending this session you have to download the Unacademy Learner app. I hope all of you have that, right? Okay, so thank you very much. Thank you for listening. Good evening and bye bye to all of you. Thank you.